For 25 years, Cheryl Lewington has watched the air quality outside her home near Southampton slowly deteriorate. And as an asthma sufferer, she's watched the same thing happen to her health.
2 years ago, I had the most awful asthma attack and I was rushed into hospital. Completely out of the blue, no warning. From that point onwards, I have not had a settled asthma at all. It's been really off the wall. And the government really needs to step up and look a little bit further down the road.
And today the government announced plans to do just that. They want to halve the number of people living in areas above the World Health Organization guidelines on air pollution by 2025. They also want to reduce the amount of ammonia emissions produced by farming. And the most polluting fuels for log burners and open fires will be banned. Given the many sources of air pollution, both outside and inside the home, campaigners welcome what's in the strategy, but are most concerned about what's not. And that's pollution from transport.
Well, it's very disappointing to see that the strategy is missing out, really going further on tackling emissions from road transport. The government recognises that this is an immediate and urgent problem to protect people's health in our towns and cities.
The government saw that criticism coming, arguing transport emissions are dealt with in previous strategies. This one, it says, brings them all together and will reduce the impact of bad air on health to save the NHS £1.7 billion a year by 2020.
This strategy looks not just at what we need to do with roadside pollution and also what we need to do in our ports and airports, but what we also need to do when it comes to generating energy and when it comes to growing food.
So for Cheryl and millions more living with polluted air in Britain, it's a question of waiting to see if government ambition translates into a breath of fresh air. Tom Clark, ITV News.